A new CDC report finds that young Americans are dying from suicide and homicide at the highest rates we've seen in decades. Researchers found that in 2021, suicide and homicides were the second and third leading cause of death for people between the age of 10 and 24 years old. The homicide rate was the highest since 1997. Suicide rate the highest we've seen since 1968. Experts say these numbers may be attributed to higher rates of people struggling with depression, limited access to mental health care, and an increasing number of guns being kept in American homes. In 2021, guns were used in 54% of suicides and 93% of homicides. Joining me now to talk more about this, Dr. Chris Pernell, Regent at Large for the American College of Preventive Medicine. This is concerning. It's alarming. What do we do about it? What does the research show about the why people are turning to violence or taking their own lives?
Good morning, Marni. As you mentioned, this is very concerning. And what we in public health have been actually screaming about for decades is gun accountability and gun safety. We know that when a person is depressed or a person has a host of different types of mental illnesses, and there's a thought or a plan about harming themselves, if they have access to a lethal weapon, then they're more likely to lose their life. So what we saw was actually an increase in depression prior to the pandemic, and then going through this unprecedented public health crisis just caused an explosion in mental illness, in particular in those groups.
And the other thing is access to mental health services. That is a major issue here. What more needs to be done to address that and make sure that people have a place to turn when they need it?
There's still stigma around mental illness. We need to be able to have open, honest, and transparent conversations where we talk about our whole person, our whole health. And mental health is a part of that. In addition to having that decreased stigma, we need access to mental health care. Too often, this care is not covered, or there are not available providers at affordable rates to families who need them. And finally, we need to have our physicians to have a greater vigilance for understanding when a young person may be displaying these troubling signs.
Thank you for watching. Go to NewsNationNow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.